Now, you might be wondering, what is geriatric dentistry? We had a class in dental school and it was called geriatrics. We called it Geri for short. And Dr. Tam Van, she was our fearless leader. Now, me and Tam Van, we made a couple mistakes during the course, during the clinical part, and she failed me. And then we had extra credit and I forgot to do it. So I was the first one to fail geriatrics. With that being said, I'm now a geriatric dentist. So Dr. Tam Van, if you are seeing this, thank you. Because I actually use all those things that we talked about, that you taught us, and I appreciate it now very, very much. Anyway, to everybody else, geriatric dentistry is a branch of dentistry that deals with the older population. So I treat, diagnose, manage the care of elderly adults. Now, with elderly adults, it comes with a few challenges. Some of them are challenges, but it's mostly just points. And I have 7 of them that we are going to talk about today. Okay, turns out I have 8 points and I can't count, so we're gonna talk about it all. Number 1, geriatrics is kind of similar to peds in that the work doesn't have to last too long. It's a lot of patching, it's a lot of just making sure the patient is comfortable until they don't need this tooth anymore. A lot of what I do, I'm making something functional, I'm making something that the patient can wear to their granddaughter's wedding so that they can smile in pictures and stuff like that. People want to be comfortable when they eat, like they don't want to be in pain, obviously. They want something to look nice when they go to social events, and even if they're going out to dinner with their friends, the people don't want to be pulling out their teeth. They don't want to be embarrassed when they want to laugh and be like, ha ha ha, like no, we want to be able to function like normal. And a lot of people, ooh, I don't love when people ask, they're like, I want to look like I used to. And I'm like, babes, these are not your teeth. These are not your teeth that you had when you were 20, and I hate to be the one to tell you that, but that's where we are. Number 2, polypharmacy. We have to worry about all the medications that these patients are taking, because by the time you're 70, 80 years old, you might have a list that's several pages long of your medications. And with that being said, if you have an older adult in your life, and you caretake for them in any capacity at all, I need you to make sure you have a list of their medications, an updated list of their medications. Some people come in with all of their diagnoses, all of their medications, the dosages, who prescribed it, exactly what it's for. And I love when that happens. Sometimes I have to tell these people, I'm like, just bring your medication bag in. Like if you bring in every single medication you take to me, I'll write it down for you. Like don't even worry about it. But sometimes they don't know they don't know what the medications they're taking are. There's so many of them, it's hard to keep track. And I don't blame them, but I do need to know what you're taking so that I can properly treat you while you're here. Oh, and the last note about polypharmacy is that a lot of medications cause dry mouth. And dry mouth is not good for the teeth. It causes the teeth to be more susceptible to cavities and decay. So I just make sure that I prescribe Prevident to basically all of my patients that are on a bunch of medications and have teeth in their mouths still. I don't care if you have 3 teeth in your mouth that you're holding on to, you get Prevident and I need you to take care of these. Number 3, we have to manage expectations. So I talked about this a little bit already, but I can't duplicate the teeth that you had when you were 25. I wish I could. I can't. That picture that you brought me, it's actually not really close up. I can't tell anything. I can make you something that looks nice and is well balanced with your face today, but the 25-year-old smile, I can't do it. And aside from the patient, we also have to manage the caretaker's expectations as well, because a lot of these people are brought in by their nieces, nephews, daughters, sons, and they're the ones making sure that they get everything done. And sometimes caretakers will try to strong arm me into treatment that doesn't make any sense for their loved one. And again, it's a lot of management. We got to manage ourselves, the patient, the caregivers. It's a lot, but it is part of the job. And I'm saying all these things about geriatrics, but they're not all bad. Like at the same time, I have caregivers that are extremely wonderful, super nice to me. Number 4, geriatric patients often have limited mobility. Monday, stop. I'm recording a video, please. Number 4, geriatric patients often have limited mobility, which means they can't get around real easy. They often need help. Either they have a rollator, a cane, somebody is literally pushing them in a wheelchair. Part of this is also they may not be able to lean back in the chair, which means I'm the one doing all the bending and then breaking my back to accommodate them. I really wish we had a wheelchair lift. Like, I think that should be a good investment for my office. But just because my back is 28, almost 29 years old and not 80 years old doesn't mean that I should put her through the ringer too. Anyway, that's why I go to yoga. It rights all the wrongs, and that's just something that I have to deal with. Aside from the limited mobility, a lot of these patients do not drive themselves anymore. So if they're not driving themselves, they have to depend on somebody else for a ride. If we really have to get everything we can done within the time that we have, we compile steps to get it done faster so the patient doesn't have to visit as many times. Then the last point with limited mobility is that patients, they may not have full control of their fingers and hands. So when I'm asking them to clean and maintain the dental work that I've done for them, I have to explain, like, yes, I would love if you use floss, but if all you can do is a water flosser, I'm happy with it. Everybody else, though, get the floss between your teeth, okay? A water flosser is not a replacement for floss. But if you're 80, 85, 90, and you can't do anything else, that is a great solution. Interproximal brushes, too. Those are good for cleaning between bridges and stuff. And, like, you don't have to do too much. They even have the ones with the big handles. You can just kind of get in and clean that way without having to do hand gymnastics. Number 5, I make a whole lot of dentures and a whole lot of partials. That means it's removable. If you don't like removable, then I don't know if geriatrics is your thing, and that's okay. A lot of people say that dentures are not glamorous, and I am here to disagree with you. Dentures are absolutely glamorous, because if you have seen the befores and afters that I have done, you'd be like, oh my God, Joy, you're a magician. And I would agree with you. I sure am a magician. When it comes to dentures and partials, there is perfect. There's also really, really good. There is acceptable. And then there's just, trash. But if we get to acceptable and the patient's happy, I'm stopping right there. Like, do not let perfection be the enemy of good enough. Getting really loud out there, but we're in the back now. It's a little bit quieter. I hope y'all can hear me. Now, where were we? Dentures, partials. With dentures and partials and things that come in and out of the mouth, that also means we do a lot of remakes, because people will take out their teeth, put them in a napkin, and then throw them away. And they'll swear up and down that they don't know what happened to it and all this stuff. Some people, they last like a year. Some, it's a few months and they're back. I'm making new ones. And I give everybody the same talk. I'm like, these are your new dentures. These are your new partials. Whenever they're not in your mouth, I need them in the case. And they look me in the eye. They're like, yes, I understand. And then they do the thing with the paper towel and throw them away. So, or somebody will step on them. But that just comes with the territory. I tell them, okay, that's fine. I understand. Let's do this all over again. Let's do all 5 steps all over again. And then that's what we do. Something I would like to learn is how to do implant retained dentures. Like, for me to learn how to, like, me personally, I would like to learn how to place the implants. I don't really want to do all in 4 because they're not very hygienic. And people who are in full dentures often didn't have great hygiene in the first place, so I don't really trust that they're not going to get peri-implantitis. But I don't know. I should probably just learn anyway, but removable, it's pretty good for most of my patients. The ones that need something else, they go get it, and that's it. Number 6, the treatment plans, they are often not textbook sound. I'll just say it. That doesn't mean they're not good enough, and that doesn't mean they're not the right choice. It just means that if we look at a textbook and we look at this patient's x-rays in their mouth, this doesn't go together. But you have to dial in lifestyle, the ability of the patient's budget. You can't do everything that you want to do, and that's okay. But as long as you are providing a good service, like good dental work to the patient, then it's going to be okay. Like, for my older patients, I might do a filling around a crown on the margin of it instead of redoing the crown. Like, this patient is 80 years old and they're happy with everything else. I'm just gonna do a filling on the margin and then fill it in Fuji. Here's some Prevident, be on your way. Sometimes there are teeth that I'm like, I don't love this as a perio tooth. It's not moving, but it looks terrible on the x-ray. I'm probably not gonna do anything about it because if it's not hurting my patient, I'm just gonna leave them alone. And this leads me into the next point. When I started working with my father, I was trying to do treatment plans and do all these things and take out all these teeth and fix everything. And he was like, Joy, don't complicate people's lives. And he's had to tell me this a few times because I didn't get it the first time. And I probably didn't get it the second time either. But he would just keep telling me, don't complicate people's lives. And that makes so much sense because these people, they are comfortable. They're comfortable where they're at. They have this old raggedy partial they've been wearing for the last 25 years. And it works for them. Are they missing like the majority of the teeth on it? And they've had to have extractions and additions to the partial and all these things. And so now the partial's holding on to like 2.5 teeth. If they like it, I'm going to keep these teeth clean and send them on their way. And at first, it was very difficult for me to wrap my head around that. But the more I see it, the more I do it, I'm like, I get it. Okay? Like, if this really becomes a problem, if my patient is in pain, I will do something about it. But chances are, they're going to be just fine. Now, the last and my favorite point, like this is the best part about geriatric dentistry, is getting down to sit down and chit chat with the old people. These people are wise, okay? People talk about being wise beyond your years. No, these people are wise because of all their years. They have seen so many presidents. They have seen so many stock market crashes. They have been married a bajillion times. They've seen children grow up, grandchildren grow up, great-great-grandchildren grow up. They've seen it all, y'all. They've made the mistakes. They've learned the lessons. And they're here to chat about it. Sometimes they're just here to tell a story. And I'm here to listen. Hey, girl. So sometimes I schedule my own patients when I can. And even if it is just a quick little denture adjustment, I'm like, you get an hour. You get an hour because I know you want to talk. And this is very important because y'all need to call your grandparents. If you don't call them, the scammers will. And they'll talk to them. They'll talk them right out of that inheritance money you thought you were going to get. Okay? But these people just want community. They want somebody to talk to. They want to feel valued. They want to feel like they're not just an old person who's a burden to their family and caretakers. Like, they just want to be. And I think this is something that I started when I was a kid because my dad would have me in the kitchen with the old people. He's like, these people won't be around forever and you like their cooking, you better learn. So I was in the kitchen with old people when I was like 8, 9, really just my whole childhood. I would go to California with my grandparents and I'd just hang out with them. I'd take care of my grandmother, and it's literally what I do now. I take care of older Black people, and it just feels so fulfilling and like I'm doing important work. Even if it's not glamorous, it's not the all-on-4 cases or big money dentistry, I don't care because I get to make a valid and impactful difference in these people's lives just by talking with them, just by solving these little problems. Sometimes people just need a little adjustment on a partial. They want one tooth taken out, and their lives are like, their quality of life just skyrockets. So that is what you're looking forward to if you want to pursue a career in geriatric dentistry. I hope that I've answered some questions. If you do have any, leave them below and I will either reply to you there or make a whole nother video. Anyway, I think that is it for today. Have a good one and I'll see y'all next time. Bye.